what are the things that kailangan i-consider ng mga Filipino nurses sa paghahanap nila ng sa pagpili nila ng state to apply for the NCLEX?
So the one that you need to take into consideration is that state issues an active license. So there are recruitment agencies who will ask you to get an active license. Like way back 2000 or 10 years ago, 15 years ago, some of the nurses has passed NCLEX through California Board of Nursing, right? Way back before, they don't have social security, they don't need social security number to take the NCLEX. But now, California is asking, you cannot take NCLEX through California Board of Nursing without the social security number. So if you pass NCLEX through California board and the recruitment agency wants you to have an active license, then all we need to do is to transfer your scores from California to a state where you can get an active license, like Illinois. So that's one of the reasons that you need to take into consideration the state that issues an active license, and also the states that do they require social security number, or do they require English test, like Nevada. If you choose Nevada, you can take the you can take the NCLEX with you cannot take the NCLEX without the English test, which is the PTE or TOEFL. Arizona also, if you want to take the NCLEX through Arizona, you can take it even without the social, but you have to take the English test because those are the requirements also. And there are also states that requires you to have an experience, like for Minnesota Board of Nursing, if you graduated more than 4 or 5 years ago, you need to have a refresher course and you need to have an English test. So take note of the states that require those. Choose the state that does not require those, because it will just be a smooth process, like Texas, Illinois, and New York. They don't need social, they don't need English test. So that's the highly recommended state.
In addition to that, so Miss Jean, we also have to check if when was the graduation date, because there are states done wherein it will ask you if you graduated within the past 4 years or less than the past 4 years, and then they will require the experience if ever that you have graduated more than the past 4 years. So those are the things that you have to look into.
For Saipan Board of Nursing, it is also an easy state, but then if you graduated more than 10 years ago, you need to have the refresher course through the approved refresher. Like there is the list of certificates that you need to take, or you have to pay that 595 something dollars to get that Kaplan refresher course. So yeah, those things needs to be considered too.
And also, if ever that the applicant is outside of the Philippines and the applicant is looking into sitting for the examination in the Philippines, they have to consider what is the length of the application validity. I mean to say, because there are applications wherein it's just valid for 1 year, and also there are applications wherein it's valid for life. So they have to look into that matter as well. When is their target examination date, and versus the length of the validity of the application as well.
Yeah, for New Mexico Board of Nursing, that is also an easy state. But then the application for New Mexico is just valid for 6 months. The fingerprinting is valid for 6 months. So if you start the credential evaluation and you already started it without thinking that the length of stay for the credential evaluation will take time, and you started the application process in New Mexico, and it's more than 6 months already, and you also send the FBI cards, then you have to redo that before you take the exam.
Actually, there are a lot of considerations, and that's the reason why we exist, because we want to make sure that the applicant has a hassle-free exam application, and then they don't have to take so much time and researching for these things. Actually, there was one applicant whom I met. That was, I think, 2 years ago. She applied through a certain board where in that board required to have a social security number. Now, she's already done with the credential evaluation, but she didn't know that that board of nursing will require a social security number. So that meant that there was a waste of money in there because she didn't know that she has to have a social security number. So we have to reroute to another board of nursing so she can proceed with her application. So maraming bagay na pag-iisipan before na mag-a-apply ng NCLEX.